Is Medicare drug coverage getting less expensive or more expensive? Well, it depends on how you ask. And just like any statistic, things can be construed. They say that 97% of statistics are made up on the spot, like the one I just made up. So, what's happening in the world of prescription drug plans? Well, if you've had a prescription drug plan for more than a minute, you know that the cost of your prescription meds has been going up, but that the maximum out of pocket has been going down. Today, I'm going to react to an article that says the Medicare Part D premiums are decreasing for many standalone prescription drug plans in a number of states in 2026, and this comes from KFF. Now, KFF used to be called the Kaiser Family Foundation. KFF is a nonprofit, a research group and what have you. They are always looking at what's happening in healthcare and specifically Medicare oftentimes. And this is what they say. Few plans are increasing premiums by $50, the maximum allowed under the PDP stabilization demonstration. Oh boy, I got a lot to explain here. If you have original Medicare and a standalone prescription drug plan, or if you have Medicare with a supplement and a standalone prescription drug plan, then your prescription drug plan was allowed to increase by as much as $50 a month next year. That was the maximum they could increase and still be part of this premium stabilization demonstration. Now, if you have a Medicare Advantage plan, it also could have increases. And what I'm going to talk about will still have application for you. So stay with me and let me explain this. The Inflation Reduction Act that was passed, a couple of years prior was fully going into effect right at the time of the presidential election. And I'll tell you, politicians, they don't like things to get ugly right before election. And unfortunately, there were some good things and some negative things about the Inflation Reduction Act that we're still feeling today. On the good side, it limited the total exposure for medications, meaning how much you could spend on medications, to $2,000 in 2025 and $2,100 in 2026. So everyone was excited about that. The worst case scenario is $2,000. Well, guess what? Very few people were spending $2,000 on their medications on Medicare already, but the ones who were spending $4,000. And their medications were costing a fortune. I met someone just a few weeks ago on one of these, on a YouTube live here, that had a $200,000 a year medication. $200,000 a year for their medication. Not what they spent, what it cost for the pharmacy. So the cost of medication has gone nuts. So then last year, when it was the general election in 2024, Biden administration said, we've got to do something because everyone's premiums were going to go up. The numbers came out and premiums were going to go up by hundreds of dollars on prescription drug plans. So they introduced the Premium Stabilization Demonstration. A demonstration from Medicare means we're going to do a trial on something. Their trial was, we're going to try something out. We're going to give insurance companies hundreds of dollars per person to keep their prescription drug plan costs from jumping too much. I mean, it's really phony, but at the same time, thank goodness for my clients who were going to have massive increases. So the Premium Stabilization Demonstration said, basically, we, the federal government, are going to give insurance companies a lot of money to not tell everybody how much insurance plans are going up, so that and if you accept that, because insurance companies had the choice not to do it, of course, everyone did it. But if you accept that, then the most you can increase your premiums is $50. So we saw in 2025 that on average premiums for the people with Medicare went up a little bit, but the total premium went up a lot, like a lot. But the government paid a lot of it and you only paid a little bit of it. Well, what's happening in 2026? Okay, let's look at this. CMS just released information about Medicare Part D plans for 2026, including plan availability, premiums for the coming year. As of this year, Medicare's open enrollment period approaches. There's some good news for Medicare Part D enrollees when it comes to the monthly premiums. They're lower on average, according to CMS, as the total number of PDPs available drops yet again. So remember I said there used to be a ton of options, and now there's almost none. Like people have, in some places, 6 to 9 to choose from when they used to have 60 to 70 to choose from. 6 to 9, because insurance companies can't afford this. Insurance companies just pass costs on to everybody else. If you raise how much it costs an insurance company, they're just going to raise how much they charge you, because they just aggregate everything into a pool of money and pay claims on the simplest form. Listen, there are problems, and I am not here to defend insurance companies. I'm just telling you what's going on. So, this whole thing that costs went down, I'll tell you what happened. So somewhere, I want to read this line, somewhat more unexpected than the reduction in plan availability for 2026 are the year-over-year premium changes for PDP. A comprehensive KFF analysis will follow in the future, but it appears that substantial premium increases for PDPs across the board did not materialize, even as the Trump administration scaled back the level of support for additional PDP subsidies through the temporary Part D premium stabilization demonstration established by the Biden administration. Okay, so this is telling you about how the Biden administration tried to hide the fact that they were going up. They're saying premiums didn't actually go up. How did that happen? Let me tell you how that happened. The way that insurance companies kept premiums from going up is they passed more cost onto people, onto the beneficiaries, onto people with Medicare. They passed more cost onto you. Because in the past, there were prescription drug plans that were, say, $20 to $30 a month and had no deductible and had immediate coverage for your medications. Not anymore. Now you have prescription drug plans that look really great. You know, you're window shopping, you're like, oh, look, this looks amazing. You look in through the window and you're thinking, oh my goodness, this is going to be amazing. I'm going to get this incredible prescription drug plan. It's like window shopping into a window display where everything is perfect. But then you walk inside and you realize that's just the window dressing. That's not what it's like. And here's what I'm talking about. We have a lot of prescription drug plans in many parts of the country that have a $0 monthly premium, where in the past, you paid $10, $20, $30, $40. $0 monthly premium. But guess what? The full cost of the deductible is being passed on to beneficiaries. And the full maximum amount that an insurance company is allowed to charge beneficiaries, you, individuals, is being charged. So if you look at just the premium, this is what I'm talking about. You can make any statistic look good in some way. There's always a statistic that can fool you. So instead of looking at are the monthly costs going down, we should look at what's the total cost to beneficiaries doing. Well, guess what? For almost everybody, it's going up. So if you only look at your monthly premium, but you don't look at deductibles and your co-insurance and how much you're paying out of pocket, that's really silly. It's really silly. It's cherry picking something to say, hey, everything's good. Don't look behind the curtain. Everything's fine. And things are not terrible. But what we're seeing is a frightening trend. With all these insurance companies going out of business, no longer offering prescription drug plans. There used to be tons, and now there's very few. And then those who are offering it at a lower monthly cost with much higher co-insurance. So more people are going to hit the $2,000 max out of pocket is the moral of the story. More people will hit the $2,000 max. When we didn't have a $2,000 max, most people were paying much less. Now, those who were really hurt, who had really expensive medications, they felt it. They paid like $3,600 to $4,000 a year to cover their $200,000 medication. But now, people who used to have, maybe $10,000 in medications, they used to not hit this maximum, but now they will. Because in spite of what this KFF article is saying, in spite of what CMS has put out about the monthly cost going down, the average cost that you're actually going to spend is going up. Every prescription drug plan has formularies. A formulary is the list of covered drugs. And then the formulary is broken out into categories. And the categories we call tiers or drug tiers. So you have tier 1, tier 2, tier 3, tier 4. There were many plans that had tier 1, 2, and then tier 6, which was like oftentimes maintenance medication. Tiers 1, 2, and 6 at a $0 copay. You go to the pharmacy, you pay nothing for those. Well, now they have a $0 monthly premium, but when you go to the pharmacy, you're going to pay the full cost of those until you hit your deductible. And then when you hit your deductible, you're going to pay 25% in many cases. I'm not talking about one specific plan. I'm giving you examples of how what we're seeing sort of across the board on averages. You're going to pay 25% of the cost. So that $100 medication, and you have 5 of them, so that's $500 a month, is going to cost you $25 per medication or $100 a month when you used to get all of those for $0. So here's the question for you. Would you rather have a $0 monthly premium and pay $100 for your medications every month? Or would you rather have a $17 premium and pay $0 for your medications every month? Obviously, a $17 premium and pay $0 for your medications every month, right? That's what we had, and that's what we have lost. And so, like I said, I looked this over and I was like, oh my goodness, this is cherry picking one thing that can help Medicare feel good, help CMS feel good, that's saying, hey, things are stable, premiums are going down, but total cost is actually going up. So if we look here at this chart, figure 1, Medicare Part D enrollees in a number of states will see lower monthly premiums for many standalone prescription drug plans nationwide. Only a few national PDPs are increasing their premiums by $50. Okay, a $50 increase is massive, by the way. Especially when the average drug plan was like $20 3-4 years ago. So a $50 increase when the average used to be $20 is massive. So we look at this, AARP, Medicare RX Preferred. 4 states are having a reduction. 40 states are increasing by less than $50. Oh, that's not a big deal. Come on. This kind of irritates me. I mean, if it's increasing by $49, we're like, oh, that's not so bad. Try living on a fixed income in retirement and being told that, oh, don't worry about it. It's less than $50 a month. It's less than $600 a year. I know people that when their drug plan goes up by $49, they can't afford groceries now. They can't afford to buy pet food, and they're going to have to let their pet go. What's crazy is that they have to consider, am I going to feed my pet or get my medications? And you know what people choose? They choose to cut their pills in half. They decide that they're going to take half their medication. I'll get by. I'll take half my medication and fill my prescriptions every 2 months so that I can get dog food for Fido. And I don't blame them. That dog is their companion. That is really important to your health, right? So I'm really disenfranchised with this headline here. Okay, monthly premiums for Medicare Part D, I'm on figure 2. For standalone plans available nationwide or near national basis in 2026 will vary widely, both across plans and across states. So where are you going to have the most expensive costs? Looks like California, New York, Connecticut, etc. Where is it most affordable? Michigan, New Mexico, Maryland. Hey, congratulations, guys. For this particular plan, the AARP Medicare RX Preferred, you're doing better than other parts of the country. What about the Humana RX? That's a really popular one. Well, in a lot of states, it has a $0 monthly premium, unless you're in New York, and then it's $158. Geez. Or California, $104. Kind of crazy how you can see this variation. Let's look at one more. The WellCare Value Script in many states has a $0 monthly premium, but again, New York, $42.40. And some of these states, New Jersey, Hawaii, Alaska, $19. So this is one of the more lower cost plans. You can see from this that the monthly cost in many cases is slightly lower, or at least it's not going up $50, which apparently was their big mark, is, hey, it's only going up $50 or less, but that's not a good measurement. So that's my reaction from KFF. KFF is just reporting on what CMS is saying, and I'm telling you, it is deceptive because, it's like Mythbusters here. Is this true? Is it not true? Technically, on the very narrow thing that they're saying, it's true, but who cares? Who cares if your monthly premium is going down a little bit, which in many cases it's not, but for most people, if it's going down a little bit, if your total cost is going up, it's kind of deceptive. So that's what I'm marking this. Hey, thanks for listening. If you found this helpful, then please follow, leave a like, subscribe to the channel. Honestly, we give really, really good information and really honest, straightforward content and help people to understand Medicare. And our channel needs to grow. So like, subscribe, share with a friend, and I'll see you next time.